Welcome to Toronto Children's Services' most recent updates module. Toronto Public Health made some changes to their guidance on August 20th. This module provides an overview of those changes. This module does not replace the existing modules. The full training modules must be viewed in order to meet the mandatory training requirements. Let's begin with vaccine information. Childcare operators are encouraged to develop a vaccination policy for staff and children. The policy should consider voluntary disclosure of vaccination status to ensure efficient exclusion of unvaccinated children and staff in the event of an exposure to COVID-19 in the childcare setting. Childcare operators are also asked, while maintaining documentation, to include COVID-19 vaccination information if available. As announced on August 17, 2021, the Ministry of Education intends to introduce an immunisation disclosure policy for licensed childcare settings, with rapid antigen testing requirements for staff who are not immunised against COVID-19. For more information, refer to the Toronto Public Health Guidance on vaccine information for employers. Moving on to screening. Toronto Public Health continues to strongly recommend daily on-site confirmation of screening. It is recommended that childcare operators validate daily screening for children, staff, and visitors each day before arriving at the childcare setting. This is called active screening or screening confirmation. If completion of the questionnaire is done at home before arriving, it is important to ensure that it was completed. The childcare operator and those designated within the childcare centre will be responsible for ensuring all children, staff, and visitors have completed and passed their daily COVID-19 screening. Toronto Public Health continues to recommend that childcare programs consider measures to reduce the risk of congregating at drop-off and pick-up locations. This includes limiting the need for parents and guardians to enter the childcare program. Parents and guardians should only enter the childcare centre or home if there is a specific need to do so, and the parent and guardian passes the screening. The number of visitors, this includes parents and guardians, must be limited to ensure physical distancing can be maintained to minimize the potential for transmission. Let's review expectations related to staffing. The childcare staff should remain with their assigned cohort for the duration of the childcare program. Staffing should be sufficient to have multiple staff assigned to one room or cohort consistently over the course of the day, and there should not be a need to move to other rooms. Childcare operators should arrange staffing assignments to limit the number of staff entering or working in different rooms as best as possible. For example, routine coverage should be supported by the same staff. Where different staff are required to supervise a cohort, such as covering for lunch or break, they should maintain physical distancing. Toronto Public Health continues to encourage reducing the movement of staff and placement students where possible to minimize the potential for transmission. There are some changes to masking and eye protection. Staff, providers, students, and visitors are required to wear a medical mask at all times when indoors, except when eating or if alone in a private space, or there is an exemption. Adults are recommended to wear medical masks outdoors when physical distancing cannot be maintained. Eye protection, such as face shield or goggles, is required for individuals working in close contact with children who are not wearing face protection or when physical distancing cannot be maintained. Staff should consult with their occupational health and safety lead or Ministry of Labour guidelines on which PPE is required and when and how to wear PPE. This would include wearing a mask and other PPE if required at other times when physical distancing cannot be maintained, including, but not limited to, providing direct care, for example, feeding, assisting a child with hand hygiene, consoling an upset child, assisting a child with changing, or cleaning up bodily fluids with the risk of splashing. Just a reminder, a face shield does not provide equivalent protection to a mask. A mask should be worn and then a face shield or goggles on top of that. Moving on to masking for children. Children in grade 1 and above are required to wear a medical, cloth mask or face covering while indoors at the childcare setting or in hallways, unless there's a reasonable exception for medical conditions, such as certain health conditions or special needs. Children are not required to wear masks outdoors, but physical distancing should be encouraged between cohorts as much as possible. Children in junior and senior kindergarten are strongly recommended to wear a mask while indoors at the childcare setting, including hallways. It is also strongly recommended that children aged 2 years and older wear masks indoor spaces, if feasible and tolerated. Masks should always be kept on when children are lining up outdoors to come inside. Masks are not recommended for children under the age of 2. The use of non-medical masks or face covering for children aged 2 years and above will be required if taking public transportation to childcare. When masks are not in use, a child's non-medical mask or face covering may be stored in a clean paper bag, envelope, or something that does not retain moisture. If using plastic bags, they should only be used for short periods of time. Containers can also be used, but they should be cleaned and disinfected after each use. Paper bags and envelopes should be disposed after use. If fanny packs are used, they should be labeled with the child's name. If the mask is put directly into the fanny pack without a paper bag or envelope, the fanny pack will need to be laundered. Masks should be replaced when they become damp or soiled, and children should practice proper hand hygiene before taking off their mask and before putting it back on. Let's discuss mask breaks. Plan mask breaks during the day for all individuals, including children. If children must take masks off when they are indoors, ideally they should be seated, not moving in hallways, and keeping 2 meters or 6 feet from others. If this is not possible, they should be seated with their cohort. Windows should be open if possible for circulation. Children are not required to wear masks when outdoors, so mask breaks can be taken at this time. However, when outdoors, physical distancing should be encouraged as much as possible. Let's talk about sensory and singing. If sensory materials, for example, Play-Doh, water, or sand, are offered, emphasis should be placed on hand hygiene before and after use of materials. Physical distancing should be maintained as much as possible. Suspend group sensory play activities if an outbreak is declared at the childcare program. Singing is now permitted indoors. However, masking and physical distancing is recommended. For general information regarding sensory play, please refer to Toronto Public Health's Infection Prevention and Control in Childcare Centres Requirements and Best Practices document. Let's finish with physical activities. High-contact physical activities are defined as activities where 2 meters or more cannot be maintained. These activities should take place in outdoor settings only, but masking is not required. Low contact physical activities are defined as activities where 2 meters or more can be maintained. These activities are permitted indoors and outside. In shared outdoor spaces, it is strongly recommended that cohorts maintain physical distance of 2 meters or 6 feet or more from other cohorts if operationally feasible. This concludes the update module. Please inform your supervisor or director that you have completed this training module. We have provided a list of additional resources for you to access, and they can be found on the website along with this video.